before we go into the session with Mufti before lunch. Anybody want to make any reflections to keep the audience attentive? Professor Saiful Islam, your reflections on the 3 days.
Okay, thank you. Uh, it's a wonderful experience because it is a continuation of Diversity project, and again we are discovering all the things. Because when we completed the project, we are very happy, and maybe we forgot everything. Again, rediscovering, and this time actually we are doing the things in another perspective. Specifically, the studies hands-on or the things assignment you actually assign to each group, and when they present, actually we got the different perspective or what actually they are really thinking. So I personally also amazed by seeing their actually thinking capability and what about the inclusive education and all this. Otherwise, we are just delivering the lecture, and whether the audience are getting or not, we don't know. So when you actually give some task, and then you can realize what actually the real situation is. For example, to prepare an accessible document, we don't know what is accessibility. Even then you assign to prepare an accessible document. So different groups actually realize what is accessibility and how to prepare it and what is the difficulties. Okay, so I think it is a very good experience for all of us, and I think we may contribute more in the coming days in this British Council project. And one most important thing, yesterday we, from the feedback, if we actually convert all these materials or all these toolkit in Bangla, and which may be applicable for the primary or secondary level of Bangladesh, then it will be very good. And these things may be hand over to the Department of Social Welfare of Ministry of Social Welfare. Actually, they are looking look after the affairs of all disabled people. So that will be the most appropriate. So I don't know how we can connect this, okay, this British Council project, diversity project, and we build a very good resources. So if these resources all can be transferred into Bangla or native language, and then we hand over to the appropriate authority, it may be immensely benefited to the targeted people. Okay, so these are my very simple comments. Thank you very much.
Thank you, Professor Saiful Islam. So didn't we have, just to pick up on the point just raised there, didn't we have a Bangla version of the toolkit? Nick, is that up and running?
We prepared the Bangla videos, right, of the toolkit and the training of the toolkit. Yeah, there are some videos, but I think that they have not been uploaded to the website.
Okay.
Make sure that they are
So it's really important that we start to increasingly look at having versions of the toolkit and the appropriate tools in Bangla too. I know for the text-to-speech engines as well, was one in Bangla or not so far? So I do think that's one of, yeah, our next job as well.
So they are on the Diversation website. So the original HP3s,
Yeah.
HP5s are in London.
Okay, so there is some of the course content already in Bangla. Perhaps we haven't even shown you that because we haven't got round to it. So not everything is, but we started to make moves towards getting some of the course content and some of the video reflections into Bangla. It's something, and there's also text-to-speech too in terms of into Indian native languages, but we need to perhaps have another project to do into Bangla too. That's a really good point, thank you. Over to Mufti for the next session.
Okay, thank you very much for your input in the previous questionnaire. Okay. Can I have your attention, please? Dr. Saifullah, can we delay that a little bit, please? Yeah. Yeah. Thank you very much. I would appreciate that. Yeah. Because this is something which is very important for our workshop, what we have done, and how you think this is going to contribute to the change of your practice and benefit you in your teaching and learning practice. Okay, that is why this survey is instrumental in collecting that information. But before we get into the actual survey, okay, so there will be some questions that we realize that we're having some issues. Okay, so we'll just request you to re-enter the data for those. But for doing that, this is the QR code. So can you please scan the QR code? And this is a Google form. Okay, this is not a VVox. This is a Google form. So have you all been able to scan the QR code?
Yes, Professor.
Visit site, yes. And should, yeah, oh. No. What is trade surveillance?
Maybe well, that's wrong.
Correct, yeah, thank you very much. So I think that that's in the wrong basically. Okay, everybody in there?
Okay. Now let me just introduce you to the questions. Okay. I think that is very important to just for you to contextualize a little bit that what are the information that we are trying to collect. Okay. So there are three different sections. Okay. In the first section, which focuses on your awareness and understanding about the inclusive education. Okay. So there are 5 questions related to that, and there will be a mix of let's say rating between in a scale of 1 to 5, and there will be open text as well, and multiple choice questions. Then there is the second category, which is in the behavioral intention and the application of the inclusive education toolkit in your practice. Okay, again, there will be 5 questions there, a combination of open-ended questions, a linear scale between 1 to 5, and multiple choice questions as well. And then finally, the third section is about the evidence of impact and institutional reach, that how you are able to evidence your impact and how you can reach in the within the institution. There are 5 more questions, and these are again a combination of the open-ended and multiple choice questions and a linear scale. Okay. So, well, unfortunately, unlike Arif's interactive session, which was very interesting, you could see everything at real time. We'll not be able to present it at real time because it's Google form, it's collecting the data, and we will try to analyze it at a later stage. So I would request you to take the next, let's say 10-15 minutes to fill in the questionnaire and or the survey, and if you are unable to understand any of the questions, please raise your hand. We are here to let's say explain what the questions mean actually. Okay, so let me just go back to the QR code if in case you need it. Please. Yeah. This is also coming from the previous questionnaire. So there is a number of different tools that are being used, so that's
Interesting
right.
though, so
Yeah.
PowerPoint, remember there's very specific guidelines, really simple how to make your PowerPoint accessible on the guidelines. And look at that, people are already using generative AI,
Which is good.
which is good, interesting, opportunities but risks too.
Yeah. Great. Now, on a scale of 1 to 5, how confident do you feel about preparing inclusive learning materials, which is really great to see that, well, that is something which, after attending probably this workshop, you are confident and you think that the inclusive learning toolkit
is going to be beneficial. Yes, David.
Already
please.
75%, 3/4 of people here are confident, are very confident about using the toolkit. That's great to hear.
Yeah. The next one is again on a scale of 1 to 5, how well do you understand the purpose of Inclusive Education Toolkit?
Again, amazing. So we're looking at almost 90%, aren't we, already? You know, it took me a long time myself to understand how to use the toolkit and understand its purpose. So that's really nice feedback to hear from 3 days. Thank you.
And then how confident do you feel about applying inclusive education principles after exploring the Inclusive Education Toolkit, which is again
80% confident.
Great, yeah.
That's very reassuring to hear. And do remember, I'll put a slide up at the end, we have 6 monthly sessions online about different aspects of the toolkit and making some new courses together. So I'll make sure you know in this network exactly when those opportunities will be.
great. Thanks, David. And then which components of the Inclusive Education Toolkit were most relevant to your context? Okay. So this is also something which is nice, that there is a wide exploration of the different aspects of the toolkit. That is nice to see that while you had the time and opportunity to explore the different aspects of the toolkit, starting from the guidelines, the Moodle portal, the mobile app of the Moodle portal, the engagement app that we had discussed this morning, the glossary, the case studies, and the best practice databases.
Yeah, great distribution there.
Yeah.
Yeah.
Before this workshop, were we aware of Inclusive Education Toolkit or similar resources? So we can see that there is half of the attendees here, they were not aware about inclusive education. So this is something which is great that now you know that there are inclusive education, and these Inclusive Education Toolkit can help you prepare inclusive learning materials. That is something which is really great.
And this is just the start of our journey together. We have many more events over the next year.
Fantastic. The next one is how well do the resources in the Inclusive Education Toolkit align with your institution's inclusion goals, if there is one? So of course, well, we understand that because we discussed about it in the first day, that not all the educational institutions here in Bangladesh has a policy regarding the inclusive education. But if there is one, well, how do you think that this is something which aligns? It is good to see that, well, some of you are saying that yes, it somewhat aligns, whoever has it. Otherwise, of course, you are the ambassador to bring it to your management, institutional management, so that there is a specific policy regarding the inclusion of inclusive education within the university's policies.
Exactly. And if your university or training center hasn't got a policy, we're certainly available to work with you. We've met with a number of higher education institutions whilst here, and we're willing to do more of those meetings to sign MOUs and agreements to move towards inclusive education if you need the help to do that.
Great. How likely are you to integrate any part of the Inclusive Education Toolkit in your future teaching or learning practices?
So we have majority at 4 or 5, 80% already, so that's great to hear. And we're keen to work with everybody, perhaps with the people who are not so sure or not so likely at the moment. We're going to engage with you throughout the year to hopefully make that even more of a definite answer in the future.
Thank you. Which specific tools do you plan to use or share after this session? So there are a number of different aspects that we can see from the toolkit, and this is something which is good to see, that well, engagement related application, the voiceover, the different assistive tools, accessibility tools, the databases which are discussed here. That is really nice to see that there is a wide variety of tools that you think are going to be useful for your practice.
Absolutely.
So the next one is, have you already identified a module or a course or a policy where you could apply the toolkit? So it is great to see that almost 35% of you have already identified it, okay? But well, then there is the 50% you haven't, but you are planning to. That is great to see that there is an 85%, that there is a very clear indication of what you are going to do.
And also that's really useful to know, so I can look at how we might help you identify parts of the toolkit relevant to your organization as part of the online sessions we'll be holding. So that's good guidance for those online sessions.
Right. Now, who in your institution might benefit the most from access to the Inclusive Education Toolkit? That is even very nice to see that, well, you have provided a number of different responses there, and the spread is also there. It is not only, you think that it is only for the disabled students, but also for students with disadvantaged female students. Some of you think that it is for all students, which we really appreciate, and also most importantly, you think that this is something also which is going to help the teaching staff as well. That is great to see.
Absolutely. You know, these are universal design for all. It means all students can benefit by including the needs of people with disabilities.
Do you foresee any barriers in adopting the Inclusive Education Toolkit within your institution? So, of course, well, there are, this was an open-ended question, so that, well, we would really try to understand that what are your barriers, okay? And then we can see that right now, for example, some of you have mentioned that there are lack of user guidelines. So if you feel that there are something that we can do to support you and your institution on the adoption of the toolkit, please feel free to reach out. And well, some of you have said that there are policy-related issues, financial issues, and support of the authority and attitudinal barrier. So in any of these, if you think that, well, there is something this team can do, please feel free to reach out to us.
And as far as possible, in terms of resources and financial issues, everything we recommend is usually open source or free to use. Everything that we develop in this project will be free for you to use.
Have you shared or planned to share the Inclusive Education Toolkit with colleagues or leaders in your institution? That is great to see that, well, 90% of you think that yes, this is something which is useful. For the rest 10%, well, if you have any specific barriers, please reach out to us. We'll make sure that, well, the toolkit can support you and your institution.
We really want to look for accessibility ambassadors in this room, that you become an ambassador within your university or college or training center for accessibility. And we're thinking of a way to accredit and recognize and reward that role for partners within this group as well. So we're thinking about that, how we do it. But we want you to be the ambassadors for accessibility.
So the next one is, can you think of any ways the toolkit might influence your curriculum, assessments, or delivery methods? So yes, well, there are a range of different answers. So yes, many of you think that it is, but there are certain aspects. For example, someone is guessing that nope, it will align very well, but well, if there is anything that you need in terms of support, please, feel free to let us know that how it can further be improved to meet your requirements, okay?
Yes, a huge amount of information here. We'll go away, digest it, and come back to you for the online sessions as well.
The next one is, would you be willing to contribute examples of practice or feedback to strengthen the Inclusive Education Toolkit? So there is more than, let's say, 97%, 97.5%, which thinks that yes. There is 2.5% who think that no. But please, well, again, if you think that there is something, there is a specific reason that you do not want to contribute, or if you think that it is not going to be useful, please feel free to reach out to us and let us see that how can we help you in making your practice better.
We really want you to author your own courses on the Moodle platform as well in the future, to reflect what you're doing in your institutions and add to the community of resources that we can share in Bangladesh.
What changes would indicate the toolkit has had a measurable impact at your institution? So again, this was an open text, and a number of different options, number of different inputs are being provided. So of course, well, policy level, as David mentioned, that we are willing to work with you and your institution to make sure that, well, that they are willing to, let's say, have a policy on inclusive education, okay? And of course, in terms of the training and any other things, if you think that, well, we can help, please feel free to reach out.
And this is really important because in a year's time we're coming back for another 3-day workshop on the changes the toolkit has made in terms of progressing students with disabilities or from disadvantaged backgrounds into your institution. So this has given us the metrics, the measures by which we can determine the success of our joint project. So thank you for that. It's very important.
The next one is, please rate the overall potential impact of the Inclusive Education Toolkit on inclusive learning practices in higher education. It's great to see that, well, there is an overall, let's say, understanding that this is something which is going to be impactful.
Absolutely, and we want to improve even further by working over the next year with you to get an even more positive result as well.
And then the question was that, well, whether you want to serve as an inclusive education ambassador within your institution. Of course, we are grateful for the 92.5% who have said yes, they would like to do that, and there is the 7.5% who think that they cannot. Well, if there is anything that we can help to change your mind, please do let us know.
And we will be looking at ways which we recognize and reward that as well, and accredit. When you become an ambassador, how we accredit and reward that role for us as well.
Okay. Great. So as you can see that, well, there is a wide range of participation here. Thank you very much, and we really appreciate your contribution here. And as a reward of filling in this survey, here's the lunch.
Yes, thank you. Thank you very much. So please, next door is lunch. After lunch, we'll just...
Well, it is not next door today, unfortunately. Okay. It is on the main hall, so you will have to follow us, okay, to go to the lunch, please. Yeah? Okay. Thank you.
Projects which might be relevant to Bangladesh that we're leading or part of big European projects in Europe. The first is how we use our computer science methods to address societal problems. So not just inclusive education, but addressing health disparities. Lung cancer is by far the most common cause of cancer deaths in the UK. And unfortunately, in the UK, and I think it's very similar in Bangladesh, it's mainly diagnosed at a late stage. If you're diagnosed with lung cancer, which can be hard to spot at stage 1, you have an 88% chance of survival. If it's diagnosed at stage 4, unfortunately, that falls to 5%. And there are economic and ethnic disparities in the UK. So we've just done a study by people in our team, published in the very reputable Lancet journal, and it looks at cancer diagnosis in England, and there's significant disparities between ethnic minority groups, and striking evidence that the people who lived in the most deprived area in the UK are diagnosed with lung cancer at twice the rate of people in affluent areas. And there wasn't even a national screening program, you might be surprised to hear, in the UK until 2022, until the introduction of the UK National Screening Committee. And I just looked quickly at the facts for Bangladesh, because I looked at some other regional statistics. Lung cancer causes the highest proportion of cancer deaths in Bangladesh, responsible for 11.4% of cancer mortality. In Dhaka alone, lung cancer is the most common common cancer among males, counting for 28.5% of male cancer cases. And again, patients are mostly diagnosed at stage 3 and 4, where there is much reduced chance of survival, even with great medical care. So, there is a technique that is used in the UK. It's computed tomography. It's just a screening technique. It's called low radiation dosed computing tomography. You might have heard of a CT scan. And it reduces cancer mortality compared with X-ray. But to be clinically effective and cost effective, we need to offer this advanced type of screening to people who are at great enough risk of cancer to benefit. So that means in the UK, a lot of people we screened in the past were at low risk of lung cancer, benefit little, and costs were high. So what we really want to do in the UK, we have electronic health records. We collect those from every GP practice from the National Health Service. We have symptoms, medications for each patient over 20 years. So what we have is this unique opportunity to train our machine learning algorithms using this data set. It's called Clinical Practice Research Data Link. It's a bit of a hassle to get to become a client of CPRD. It took me 6 months to make the application, but now we're a client. Then you have to apply for a protocol. So this means we extracted a data set of 867,000 healthy controls and 6,395 cases of lung cancer. And what do we want to do when we have this method? We want this method, this algorithm, to look at general health records sitting in GP practices and automatically identify the patients at greatest risk of health cancer due to the records that are kept, and only put those people through to this very advanced type of screening technique, low dose computed tomography, to identify at a very early stage those at greatest risk for the best screening program, because if we can do it earlier, and there are mathematical models to identify those at greatest risk, if we can use advanced machine learning from the world-leading experts here, Mufti, Arif, Shamin, the world-leading experts, to identify patients even a week earlier, or even before symptoms become symptomatic, then it will have a radical impact on chances of survival. So how did we do this? In Europe, there's a funding program called Horizon Europe. These are big projects. So this project involves around 20 partners, and they're clinicians, computer science departments, hospitals, but around 20 partners around Europe. In Finland, Austria, Belgium, Luxembourg, Italy, Portugal, Spain, Switzerland, Turkey, and United Kingdom. And I think the geographical area of Europe is around the same as Bangladesh, is it, Mufti? Somewhere around there? About the same. And the investment from the European Union in this project is around 8.5 million euros. So I don't know how to convert that into Taka, but it's a lot of money. And we have 3 use cases, but in each use case, we want to use electronic health records and have machine learning models sitting in doctor surgeries, looking at these patient records and looking at all the signals and the data to say patient X could have the very, very early signs of somebody who needs to be screened. And if we can get them through to screening, we're going to have a radical effect on the number of people who survive. Our use cases are lung cancer, prostate cancer, and ischemic stroke, the more typical causes of death in Europe from lung cancer and non-communicable diseases. We do 2 types of machine learning. So we have some machine learning specialists here and not. The most important one, I think, is federated learning. All that means is we have really sensitive health data. It's against UK law, and I'm sure the same here, to identify any patients from the health records we use. So we do a range of things to anonymize the data. One of the things we do is called synthetic data production. We don't actually use the real electronic health records. We do some clever mathematics and actually produce synthetic versions of the data and let AI developers and clinicians test their best algorithms using this hub of synthetic data. We also have a hub of machine learning models to advance the science. And in federated learning, it just means I can work in computer science at Nottingham Trent, and I could work with a hospital in Bangladesh. And without sharing our raw data, you don't have to see mine, I don't have to see yours. We can train our models together in the cloud whilst never seeing each other's real data. And really at the heart, I'm not going to go too much into this, this is one of Arif's, mine and PhD students, is if we're going to use machine learning, AI, in education or health, we have to do it in a trustworthy, ethical and explainable way. So many machine learning models, typical so-called black box models, you can't really interpret them. So any AI algorithm doesn't have to make the same choice as a human would make, but a human should be at least able to understand the processes by which the algorithm makes the decision in critical areas such as education and in health. So what we do in our models is if we might use black box or opaque models, hard to explain, but then we do some work to understand which features from the data set really influence the prediction of the model. So we've chosen symptoms such as smoking status. Have you smoked intensively in the past? Do you come from a family with general cancer, or do you have a history of cancer yourself, and body mass index? One of the surprising things I found is body mass index, a lower index, is proportional, is related, correlated to lung cancer. So, to wrap up, we're not only using explainable, trustworthy and ethical AI in education, we're doing it in healthcare too. We can address problems of early identification, economic disparities, ethnic disparities using machine learning, and we can do it at a distance. Lung cancer early identification is an issue in the UK, it's an issue in Bangladesh. We could train our models together without making sure our models and the raw data are only seen by the people allowed to see them in Bangladesh or the UK. And that's another opportunity we want to use AI for, to address issues which are common to Bangladesh and to the UK. That's our first project. Thank you. And now Arif's going to be talking about virtual reality.
Okay, so before I start, can I ask you a quick question? How many of you are afraid of snakes? That's a big number. Right. Like if you see one snake around, what are you gonna do? Okay? Okay, so that is a bit scary. Let's try to minimize that. How many of you are afraid of heights? Okay? So if you go really very top of the skyscraper building, you are afraid. And another question, how many of you are afraid of blood? Yes, there are some. I got my nephew seated at the very end. He had a surgery, and I had a chance to see immediately after the surgery, and he was bleeding that time, and I fainted. He doesn't know, I think. Anyway, so these are kind of phobias that we can be afraid of. But research has proven that if we can introduce this kind of phobia in a controlled way, we can